Hi, welcome to Case of the Day. One case every day from Monday to Thursday. We're on the 30th case, a little something different, and moves on to a little more medicine as well. And it's called Measuring Hepatic Steatosis on Plain CT Chest. So, 38-year-old man with cough, throat irritation, episodic. CT was done yesterday. I read this today. Fibrocalcific lesion, some focal fibrosis. So, he probably had TB in the past, but there was nothing else. But I looked at the soft tissue windows, you're scrolling from top to bottom. There was hepatic steatosis, and the last 20, 30 years we've been calling it fatty liver. But I think over the last 3 or 6 months, we've changed to calling it hepatic steatosis. Now, Osirix has a plugin. I don't know when it came in, but I noticed it about 2 weeks ago that allows liver fat estimation. It takes about 30 to 45 seconds to use it. So that's what the plugin looks like. And when you're in the plugins manager, and then once you want to use it, you just click on it. You first click on liver and then draw the ROI, then click on spleen, draw the ROI. It gives you the fat fraction, and this is how it does it. And it uses a formula, and I'll come back to that in about a couple of minutes. And that's the report that it gives you on a scale with the fat fraction. And then this is what you can add to the report and give to the patient. And I've started doing this for the last about a week or so. Whenever visually there appears to be moderate to severe hepatic steatosis. So the question is, what has changed? So there's a lot written about steatotic liver disease, MASH, MAFLD, that is metabolic dysfunction associated steatotic liver disease, MASLD, and metabolic dysfunction associated steatohepatitis, etc., etc. If you want to read more, there is this beautiful paper which summarizes everything that Lancet published as a seminar, I think last year, mid to late last year. But it also shows you here that when you have MASLD, which is the green, your survival or the getting all-cause mortality is higher than if you don't have steatotic liver disease. And so many tests get done, including fibroscans, MRI elastography. We sometimes just pick it up on ultrasound, etc. But the challenge is that except for alcohol cessation and lifestyle measures for cardiometabolic risk factors, there has been no way to actually reverse the disease except for resmetirom, which was a paper that came out last year for stage 2 and stage 3 fibrosis. Until last week, so on the 30th of April, this paper was published in NEJM with semaglutide. And see this, right? Resolution of steatohepatitis in 2/3 of patients as compared to 1/3 of placebo, and an actual reduction of liver fibrosis in 1/3 as compared to 1/5 in the placebo group. This is a big deal, right? Because semaglutide is a GLP-1 agonist that is anyway going to be as commonly taken as statins because people are using it for obesity and all kinds of things. It's just been introduced in India, but we're just going to see more of it and many more GLP-1 agonists being brought into the market. So if you have a commonly available drug that can reverse steatosis and fibrosis, that is a big deal. Which then means that reporting and quantifying steatosis on a CT chest or any of, maybe even a CT abdomen where you have a plain scan as an additional finding would help trigger the physician's attention to the steatosis. So the question then is, how accurate is this? If you have access, then the Radiographics 2025 article, of course, if you know me and you can just email me or ask me and I'll send you all these papers. That's not a big deal at all. So he's done this lovely paper in Radiographics on non-invasive quantitative CT estimation, and he says that liver attenuation value less than 40 HU when you're using 120 kV means moderate steatosis. But more importantly, he had in 2018 derived an equation where you could convert the CT Hounsfield into an MRI-PDFF equivalent. Now, MRI-derived proton density fat fraction estimation is the gold standard, right? And it replaces doing biopsies, etc. So, if by using this equation, which the Osirix plugin does, you get a fat fraction analysis for moderate and severe steatosis, it's not very good for mild, then that's a great thing, isn't it? So the idea is if we can see it visually, it is likely moderate and therefore worth quantifying so that further testing is triggered, and more importantly, contributing factors can then be identified clinically, and more importantly, treatment initiated, not just exercise, lifestyle intervention, all of that. You can actually give semaglutide and reverse steatohepatitis and even fibrosis. So for those of you who use Osirix for reporting, this is easy to do and perhaps worth the effort. I hope I've given you some food for thought today. That's the WhatsApp channel, and thank you for viewing this.